This episode has been brought to you by Ultra Duramune.
Welcome to another episode of Vet Candies in Other News, a podcast to expand your idea of what's impacting veterinarians, the veterinary world, and all animal care professionals as humans. I am your co-host, Dr. Jen. What? There's no Dr. Jason. Dr. Jason is not here today. It's just a couple of ladies. But you can still get a free subscription to Vet Candy. Go to myvetcandy.com. And you can still send me lovely messages at jen@myvetcandy.com. So our topic today is preventive medicine. In other news, prevention works? Yeah, prevention works. And so we're going to talk today in the Candyverse with an expert. She owns multiple practices. She speaks multiple languages, and she's a champion fencer. That's right. If you thought that I was going to bring in Dr. Marta Sanchez-Emden, you're right. So Dr. Marta is joining us in the Candyverse. Welcome, Dr. Marta.
Hey, how are you, Dr. Jen? Happy to be here with you.
Yeah, thanks so much for coming to the Candyverse. I know, I keep looking over at like my empty chair, like there should be one there. Because Jason's not here. But that's okay because I want to nerd out a little bit and talk about one of my favorite topics. Well, actually several of them. So number one, you own multiple practices.
Yes, I do. I have two practices in Florida. And it's funny because I still remember to this day about maybe 18, 19 years ago when one of my bosses told me, Marta, you're a single mom. You will never be able to have a practice, even if you want to. And
Are
there
you kidding me? Are you kidding me?
That's true.
Wow.
It's a true story.
Wow, that's incredible.
I really didn't think about owning my own practice until he said that. I went like, so maybe that should be my next goal.
That's right. I was just going to say, and you went, all right then, challenge accepted, right?
Exactly. You've been served.
That's right. You've been served, right? The gauntlet is tossed. Yeah, that's fantastic. So I must say, I'm very impressed because I have owned two practices, but not at the same time. At the same time, I would think it'd be a lot to manage because I know you're also a mom.
Yes, I'm a mom. I have two kids. One is 28. The other one is 12. Big difference in between. And it's very difficult. It's impossible to do it by yourself. So I have a husband that supports me. He's been on the veterinary field for over 25 years. So that's a big help. And I can say that thanks for his help, I've been able to do it because it's difficult to be a mom and to be a practitioner that is an owner of the practice also. It's very hard.
Yeah, it is hard, but that's not all you do. If that was all you would do, maybe you could handle all of those things happening, all of those irons in the fire. But you do more than that. And I have to say, I'm always hearing about places you've been. You were just in Cairo, is that right?
That's correct. I was in Egypt in October when we could still travel in the World Championship for senior fencers. I've been practicing fencing for many, many years, and it's not something new. Before vet school, remember that? I used to fence in the national team for my country. And when there came the time where you have to decide, I got accepted to vet school. I was living in Puerto Rico, and I had to make a decision. Should I keep fencing and continue with the international level competitions or go to vet school? I decided to go to vet school, and in vet school, I did a little bit of fencing actually in a nearby university, but it's difficult. It's really hard. And then I got pregnant in vet school too. So fencing had to wait, and I started fencing a few years ago again after I had my kids and after I had my practice.
Dr. Marta, wait, back the truck up. Did you say that not only were you fencing a little bit, you were continuing to dabble in fencing in veterinary school, you were going to vet school, and you had a baby?
Yeah, I it wasn't planned, and I got pregnant the second year of vet school, when you have the blocks and it's a year that you really have to do all the memorization.
Yeah.
And I had my baby because I didn't think there was an option like quit vet school. Why? Why? That's a crazy idea. So I had my baby in vet school, and when I graduated, my baby was 2 years of age, and I remember the graduation, holding him on my arms with my diploma and the rest of my classmates, and I'm really proud of it. And that baby is now the one that I said is 28, going to be 29.
Yeah. How fantastic!
So
everything
everything you want to do can be done. Just you have to be organized and just keep your goal in mind.
Yes, I love it. I love it. So we're going to take a quick break, but then Dr. Marta and I are going to get down to some business. We're going to talk about how do you effectively market and reach different populations in your community so that you can talk about preventive medicine. So hang with us and we'll see you on the other side.
Canis lupus familiaris, otherwise known as the family dog. Renowned for their unconditional love of anything wet, smelly, and gross. So proud. But beware, Fido, where there's fun, there's leptospirosis. A dastardly and potentially fatal disease. It can lurk inside the bladders of many of our favorite outdoor friends. And when they pee, lepto runs free, contaminating environments that are closer to home than you might think. I'm talking to you, city dog. And you too, suburban dog. Just because you're not out in the woods doesn't mean you're out of the woods. The threat of lepto is everywhere and can spell terrible, no good, very bad things for good boys and girls like you. But hope is not lost thanks to highly purified, low-volume lepto vaccines that are safe, effective, quick to administer, and designed for fewer reactions. Yes, the time to act is now for all of us to do our part to protect these curious creatures on their quest for good, clean fun.
Okay, welcome back. Welcome back. So we are talking with Dr. Marta Sanchez-Emden, who I think may fly around. I think she commutes potentially in an invisible jet. I'm not certain of it, but I think she might. This sounds crazy, all the things that she's doing. But there's a key to that, to her success. And we're gonna dip down into that. I want to talk about you come from a different culture than I do, and but we're the same profession, and I think that you probably have used that as an advantage to provide care to a wide array of pet owners. So tell me about that.
So I was raised in Puerto Rico, and I moved to the United States when I went to vet school.
Oh my gosh.
So cultural shock. There was no social media or anything at those times. So when I went to Alabama from all the places, it was a big cultural shock. Now my practice
Puerto Rico
is in Miami.
Alabama.
And I can tell you that I didn't understand the accent of the South by that time, and people didn't understand my accent.
Yeah.
But when I graduated, I came to Miami. I practiced in Miami, and in Miami, I have pet owners from Brazil. They speak only Portuguese, and I have a lot of people from Latin America. I have a lot of Europeans. So we have learned to communicate with many of those pet owners that might speak a little bit of English, or might be fluent on English, or not at all. And it's important to keep in mind that they come from different cultures, and many times they have medical records with all the work done by their veterinarians in their countries, and we have to modify and continue what they were doing in their country, even though it's a little bit different from the way we practice here. I really enjoy practicing in a city that has so many people from so many cultures.
Yeah, that's pretty incredible, because I know Portuguese is not Spanish. It's not even close.
It's not, and actually, in my opinion, it's more complicated. But you
Yes.
can if you use English, Spanish, and Portuguese together,
Yes.
you might be able to communicate, and that's how we do it in my practice.
But you know what? The one thing that I also had a practice that was the majority of our clients were bilingual or Spanish speaking only. And I was on the border of Texas with Mexico. And in fact, my practice was, I think, about 2 miles from the border. And so, yeah, we had to learn to communicate. But one thing that was evident, no matter what language they spoke, what language we spoke, they loved their pets. Everybody that came, they were there because they loved their pets and they wanted help for their pet. And so that made it a lot easier because we both had a vested interest in communicating with each other over the top of the little dog that was in front of me.
Yeah, and one thing that I thought that is very interesting is that many times some Latin families, you talk to the father, but then the mother calls you and you need to talk to her, and then the daughter calls you and you have to tell the story to everyone because they're so close to their pet. And yeah, that's true universally, but I think that in the Latin families, sometimes it's even more to the point that you're almost telling the owners, whatever you talk to your daughter and to your son and to your wife, do you want me just to send an email so everybody is in that information?
No,
but it's a good thing. It's a good thing.
100%. It was the same thing. There'd be a whole team of folks that were there, and every single member of the team had a vote. And so they all had to get the information so that I had to get everyone to buy in. And I agree with you. I think that is to some degree unique to the Latin culture, at least in my experience. But I thought it was great because I tell you what, there was no doubt what we were going to do with that pet. By the end of it all, when the whole team knew what we were doing, everyone had their say. We were moving forward very confidently. So there are advantages to that piece of the culture there.
So I was going to say that one mistake that I see a lot of veterinarians from US make when they have a client that has an accent and they speak broken English is that they assume that they don't understand the medical conditions and they talk like they're talking to a little kid. And we have to keep in mind that many of the immigrants from Latin countries or other countries that come here, many times they may not speak the language 100%, the English 100% correctly, but these people may be PhD, there might be medical doctors, they may be professors at the universities in their country. So just because they have an accent or they don't speak perfect English doesn't mean you can talk at their level. So that's why it's important many times maybe to have somebody working, a technician or a receptionist that hopefully is bilingual, or have the information, written information in their language, in Spanish or in Portuguese or in whatever language that person is their first language.
Yeah, I do think that's important because if we talk about the concept of informed consent in order to treat a pet, you have to kind of you have to make sure, if you know for a fact that this client, this pet owner, that English is not their first language, then you really have to make sure that they understand what you're saying. But what I did find very helpful when I was doing work down in South America and Central America, because my Spanish was probably at about the level of a 3 or 4 year old. However,
let's try, Jen.
No, let's not try, Dr. Marta. But what I did find was that medical terms frequently translate very readily because they're Latin based. And so whether I was talking with somebody who was from Chile, from Argentina, from Mexico, or a few times from Italy, which was very interesting, we could talk about medicine with not a lot of effort because the terms were similar.
It's true, but some late terms are completely different. For example, I get a lot of people that the husband brings a letter from the wife hey, Dr. Sanchez, can you check the skin is red? Also, it's limping from the right side. And there's some llagas on the head. And they put llagas is a word in Spanish. So they use this Spanglish that I don't mind because I understand, but llagas is a secreting ulcer. And it's completely different. So yes, you're correct. Many of the words are from the Latin, the medical words, but the later words are everywhere, all over the place.
Yeah, that's right. And it depends on what region of what country
oh my
that
God,
anyone
yes.
is from. Yeah, and so so I find it very helpful. So if you had to make like one, okay, maybe two, but really one recommendation to practitioners who may find themselves living in an area where there is a population of folks who don't speak English as their first language. And let's say it's not Spanish either, because that's cheating for you because you speak Spanish very well. But let's say they speak, I don't know, Chinese. Maybe they speak Mandarin, or maybe they speak Farsi, right? Or something like this. What is the one most important recommendation that you would make to that practitioner in order to reach out effectively to that population of folks?
Well, you asked me for one, but I want two. First, the main information about vaccines and preventive care, I would have it on paper on that language. And number two, as a practitioner that wants to enrich their knowledge, I think that person should be an effort to learn a little bit about that language. That would be a really good idea.
So like even just a greeting, like good morning or good day or how are you? Just something, even something?
But yes, but why not a little bit more than that? If you have the time. I know it's difficult. I know practitioners are very busy, but why not? Like, yes, greetings, yes, thank you, yes, goodbye, but try it a little bit more than that. Who knows? You might become fluent in Chinese Mandarin.
Oh my gosh. But the thing, so the kind of the trap that happens to me is that if I get really good at delivering, an opening phrase, and then the person, they get very excited and they start talking to me in the other language, and I'm like, wow, stop, what? Now we've exhausted all I know.
You know what happens to me, that I'm talking to a person that has an accent in English and I'm sure they speak Spanish, so I switch to Spanish like that, and I realize they don't know Spanish that well because they weren't born here, they're second or third generation, or they speak Italian, the main language is Italian or Portuguese, and the accent in English sounds similar to mine, but it's not Spanish. So it happens a lot. So I first have to kind of like try to see what language they prefer. Yeah, it's funny. It's like a game. I like it.
It is. As long as everyone's having a good time at the game, it's okay. It's okay.
Because you're not rushed, right? And you're not talking about euthanasia and things like that.
Oh, so yeah. That would be tricky. So then you mentioned that it would be good to have the kind of your standard protocols or your like routine client information sheets in that language. Is there any source that you might recommend for translation? Because you don't want to translate it wrong, right? You don't want to have it be incorrect, and then So how would you recommend that folks make sure that they are getting an accurate translation?
So, Jen, there's many of the pharmaceutical companies that offer that information in Spanish for practitioners for free. Forget about Google Translate. Google Translate doesn't translate properly, so don't use that. Okay. I think another good idea is the invoices or the labels with the instructions for the medication should be in Spanish, because that's a big source of mistakes. When you put a label, write the label in English, and the person doesn't speak English, they can accidentally give the wrong dose or in the wrong form. So also the software you use is important. Some of the software will translate for you automatically.
That's interesting. Even if they do speak English and I put it in English on the label, they still sometimes end up putting the eye ointment in the ear.
Correct. That's true. Yes. That's very true.
So it's not always a case of a different language, right?
Right. It's a case of reading carefully and listening to the doctor, listening to the instructions.
Yes. And so I want to make sure and ask you about this. So one of my favorite pathogens, as the news hounds in the Candyverse are well aware, is lepto. right? I do like lepto. I don't like to get lepto, right? But I like lepto as a pathogen because it's worldwide, it's present everywhere. And it's one that we can prevent with a vaccination. But it's one that seems to be difficult to get a lot of folks to recognize the need for prevention.
Lepto for me is not difficult at all. And the reason is because many of the people from Latin America or Latin descent, if there's one disease they know is leptospirosis. Why? Because it's very common in subtropical and tropical areas like the Caribbean, the northern part of South America and Central America. And it's a disease that will flare up when there's hurricanes, major climate
rainfall.
Everybody's pretty aware, and it's a vaccine that when I say, your dog hasn't been vaccinated now in 2 years for the lepto, it needs it. They're the first one that say, oh my God, go ahead and give the lepto vaccine. So leptospirosis is very important. It's zoonotic, and just like rabies, thank God most people are aware of its prevalence. Now, on the northern area of the United States, because I don't practice in that area, I don't know, you can tell me, is it more difficult there in the northern United States?
It can be, because it's yet another vaccination, and there's all these myths on the internet about the lepto vaccine reactions and stuff. Because originally the lepto vaccines that came out on the market 20 years ago were not as good as we're galaxies better at making vaccines than we were then, and so it can be difficult. It can be difficult to get practitioners to recognize the value of the lepto vaccine. But that's interesting. So that's another reason to reach out to an underserved population, because I don't have to educate. They're already fully aware of some of these pathogens.
And when some of my patients that travel during Christmas or summertime to their countries, many of the countries will require not only leptospirosis to travel back, but also, not only rabies, but also leptospirosis. So it's required by many countries for the animal to enter. So it is a really important vaccine, and most people that I know in my little world, in my geographic area, are aware of it.
Oh, how fantastic. Well, that's great news. But you know what? I got to tell you, that is an advantage. That's an advantage of a cultural difference right there, for those pets and for their veterinarians. And so, anything else that you want practitioners who maybe have that Southern accent like me as our accent, anything else, like one more useful tip like that? Because that's incredible to realize that about different areas.
No, you're just, be, I know sometimes we get really busy and it's difficult to communicate with the clients, even if their first language is English. Yeah. Just be patient and remember that we all love our animals regardless of our race. So let's embrace let's celebrate the love for animals and take care of all our pet owners.
Yes, and you know what, I will second that. There was never, it's not like owners were trying as hard as they could to understand my 3 or 4 year old Spanish because they didn't like their pet, right? They were trying as hard as they could because of their deep love for their pet. And I think that's universal. And perhaps if we can remind ourselves of those things we have in common, it makes it a lot easier, and it makes a lot more sense for us as practitioners to reach out to those populations that are a little different from us in our area.
Yeah, and Jen, remember that not everybody can afford veterinary care.
Absolutely.
And one of the goals for me have been to reach Latin populations that cannot afford veterinary care. And I have done it through the media. I do work in Telemundo. I worked for many years in Univision, and I work on CNN Spanish also. And the reason is because I want the people that cannot afford veterinary care to have the latest on medical techniques and preventive care on diseases now with the coronavirus, to understand where the facts are. So we have to take care of everybody, all pet owners, regardless where they came from or if they can afford veterinary care or not. Then we can consider ourselves successful veterinarians.
100%. And because to me, as soon as you seek help for your pet, you're a good owner, because you didn't have to do that. You didn't, A, you recognized that your pet needed something, and B, you did whatever it was that you could, which doesn't just necessarily mean having funding, but you did whatever you could to find help to take care of your pet. And I think that's critically important. It really is why we do what we do, to try to take care of the entire family, and make sure that they can all live together safely. And so I think that's wonderful. And you kind of undersold that a little bit. I think you are the veterinarian for Telemundo. I don't think you do some work with Telemundo. I think you are the veterinarian.
I was a resident veterinarian for Univision and for many years, like 7 years. I'm the resident veterinarian for Telemundo now and for CNN also. And it's solely for the Spanish media. And I'm really happy that I can do that. And it makes me feel that I'm helping not only my patients locally, but these channels are national and international. So I feel that I can pass information, important information for all the pet owners out there that don't speak English.
Absolutely. Absolutely. I love it. I think it's fantastic. I wish that I could still speak Spanish, even if only at my 3 or 4 year old.
I'm sure you can. I'm sure that if you spend a week down here with me, you will get it like that.
I would hope so. I would hope so. And hey, don't offer that, Dr. Marta. Don't offer that, because it might happen. You just don't know. It might happen.
Oh my God, I'll be happy to. Anytime, Jen.
We could do an episode of In Other News from your practice. That would be so fabulous. Yes, I love it. I love it. So, folks, this has been a wonderful, wonderful conversation with just us girls here, talking about how to reach those underserved populations, and hearing about Dr. Marta Sanchez-Emden and everything she's doing to put the profession forward and to help enhance care for pets all over the world, no matter what language their owners speak. So thank you, Dr. Marta, for joining us in the Candyverse.
It was a pleasure.
And those of you out there, I'll see you and maybe Dr. Jason on the next episode of In Other News.